Hi guys. Today I think it's time to talk about MS and infections, and later on about AGCT and infections. So let's start with MS, and MS is widely thought to be autoimmune disorder or disease. And basically what autoimmunity means is that simply humans' healthy cells or some body tissue is being attacked by the defect immune response to an infection. And that is what happens is in MS. The body's neurons, nerve cells are being attacked by nasty lymphocytes. Usually when any kind of immune response occurs. Was it after infection or stress or exercise, physical exercise or... Okay, now let's talk about infection. What is so significant in infections and how infections are related to worsening of MS symptoms and MS progression. We can talk about in general of an infection when an intruder coming naturally from the outside, whether it was a bacteria or a virus, it will enter our system, it will attack our system unless our immune system will fight back. And we have lymphocytes, a type of white blood cells that are meant to fight any infection. But for some reason, people with autoimmune disorders like MS and lupus and conditions like that, these people tend to have a less normal immune response after such an attack. And in addition to the normal lymphocytes, these people with autoimmune disorders, they have these less normal defect, bad cells that will not attack the intruders that they are supposed to attack, but they will attack the body's own tissue or some type of cells in the body. And in MS, it's the nerve cells, the neurons, it's causing loss of myelin sheath, and eventually it will can lead to severe damages of the central nervous system. And since these bad cells that are activated during immune response can cross the blood-brain barrier, that is some kind of physical wall between the nervous system, the brain, and the blood. It's some kind of a prevention, protection, like a wall. But these cells are so strong and so decisive and determined that they want to cross this barrier and cause some damage, some random damage. They will attack the central nervous system in MS. They will attack randomly by causing any kind of symptoms that no one can predict, no doctor can predict, and the consequences can be anything from benign to severe and can affect any part of your body. The symptoms can be anything, so you never know. You don't want is another attack. That's why I'm doing this vlog. So anyone with any kind of autoimmune, confirmed autoimmune disorder like MS or lupus or rheumatoid arthritis, I advise you that you are taking precautions. You're being extra careful with infection that you think that can be infectious. And the reason why I'm telling you to be cautious with infections and telling you to advise you not to take it lightly with infections is the fact that any kind of infection, whether it was a flu or a serious kind of flu or food poisoning, any kind of infection can and probably will affect your MS symptoms. They will either get worse, the old symptoms can get worse significantly or at least a little, or in the worst case scenario, you may have another relapse bringing you some new symptoms that you never had before. And you can never risk it by thinking that probably I will go into remitting phase again, these symptoms will disappear, I will recover from the relapse. You never know. I wouldn't advise you to be too positive about MS, because there's nothing positive about MS and MS relapses. So that's why I'm advising you to stay from infections. And this that I'm just telling you, my advice and the tips I'm giving you in the following, especially concerning the fact that infections and MS are not a good match at all, that you should stay away. That is something I have actually personally never heard coming from a neurologist, a doctor who is treating me, anything, or any other specialist I've been seeing due to my MS, or at least I've told them that I haven't. None of these doctors has told me that I should be careful with infections, and infections probably will have a negative impact on my MS. None of these doctors has ever mentioned such a thing. But that doesn't mean that me sitting here, that I shouldn't be telling you that infections are a very, very bad thing for your MS, that you should be careful. I think you should be careful. Personally, I haven't had a regular flu for over, I don't even remember, it was maybe 5 years ago I had, 6 years ago I had a regular flu, but 4 years ago I remember the last time I had the flu, and it really did have a huge impact on huge effect on my MS. And I remember straight after or even during the time I was going through with this flu symptoms, and I developed high fever as far as I remember, but I even went to work. But right after I started recovering from the flu, I started developing these strong sensory symptoms in my lower extremities, and I still have these symptoms even 4 years after. And I had some muscle weakness, and I never was able to reverse those symptoms. So that's why I'm telling you, never ever you want to get flu or anything that really can take a big toll on your health. And if I think it now, how the situation would be if I had flus or other infections during the 4-year course I've had MS, I don't even want to think how much worse I really would be at this point. I'd probably be much worse because I haven't had a single flu. I think definitely, of course, there are other factors that are contributing to the onset of relapsing and having relapses, and really can make you relapse other than infections. There are stress, but you can manage that if you want to. There is wrong kind of exercise, that is also something that is manageable. And maybe I should be more concrete now about how taking precautions against different kind of infections. Well, basically what you want to do is just wash your hands quite frequently, and it doesn't cost you a thing, but it's probably the world's best way of keeping away all the bad infections. It just keep always a small hand sanitizer within your bag or in your pocket. Another thing that some people might not know or not actively think of is the fact that you are what you eat, and with MS you have to be, and especially with HCT, if you're going HCT, if you're a future transplantation, you're going to need to know what you are eating. It's extremely important that the food you consume, you eat, the products, whether it's raw food or it's cooked or fried or rewarmed in the microwave, that the food you eat is first of all clean, especially if it's raw. The drinks you consume, they are the water is, if it's tap, it should be clean, or just make sure you get the bottled water, good quality. Or make sure the food you eat is properly cooked. If it's rewarmed in the microwave, it's warmed probably as well, so that you won't have the chance to get any kind of food poisoning, because food poisonings are rough but short illnesses that will last a short period of time but can make you really sick afterwards. Your MS might go crazy, and that is something you shouldn't tolerate. I must admit that is really annoying sometimes when you just have to be continuously so cautious and precautions just for the fact that there can be any kind of infectious virus everywhere basically, and you cannot know. So that's why just please, if you can, try to avoid big crowds, because you never know who is sick and who is not. But if you can, just ask beforehand a friend or someone who don't know you whether he or she is sick, so that you won't end up with the scare that, oh my god, I'm getting sick. And to conclude here this vlog, I would mention a couple things concerning the treatment I'm having, the GCT, and how I should be prepared for that, concerning the nutrition and the other precautions I just mentioned. Of course, to the precautions, washing your hands and using hand sanitizers and keeping your food clean and properly cooked, you have to be extra super hyper careful and vigilant when it comes to HCT. So that is very important, because any kind of infection can be life-threatening when you are immunocompromised after and during the HCT, and catching an infection will probably and unfortunately lead to a life-threatening state, which is poisoning called sepsis, and it really is a scary thing. So you really need to take care of infections when almost directly after the being discharged from the hospital. HCT has been done and your body starts to recover slowly. The immune cells are starting to grow back, hopefully healthier than before. And logically, you are able to slowly and slowly, every day, you are more prepared and capable of fighting an infection with a healthy outcome without no life-threatening conditions. But that will probably take months until to get a safe side. But when you do get an infection that is not life-threatening at that point, you still might have some temporary worsening of your symptoms, and usually they tend to just alleviate, they tend to disappear. Just in that case, infections and MS don't go well together. I hope to see you soon. Bye!